Sometimes it does that. It'll like focus on something else and it forgets I'm here.
Computers. They're
I really like the T-Rex, by the way. I just keep
he's
staring at it.
he's my because I like to help chiropractors. So bone
Hmm.
structure and vertebrae, and I like dinosaurs too. I thought I was going to be a paleontologist when I was younger.
I would not have called that. I would have never guessed that.
It's a long time ago.
Yeah.
Well, Jason, it's wonderful to have you here with me today. You have
Glad
a
to be here.
wonderful local practice during direct primary care, and lately people have been asking me like, exactly what is direct primary care?
Direct primary care is a lot of things, honestly. It's basically, instead of dealing with all the insurance companies and all of that, it's a personal relationship with you and a provider, and that's it. There's no third parties, there's no all the fancy stuff that goes with it. It's just a relationship. And it allows you to get better prices. It allows you to get better care. It allows you to get more affordable care. Just everything all around is so much simpler when it's just two people talking to each other. So,
So
um,
why, like, what's the differences then between going to I mean, don't people get that when they go to the hospital and see a doctor instead, or?
well, I mean, the way that it works when they go to a hospital or a traditional practice is it basically gets sent off to their insurance companies, and the insurance dictates how much they're going to charge for each and every visit and each and every service that is provided. They're the doctors that you see, the hospitals, they're not really in charge of how much it costs. It's your insurance company, and as long as you're in the insurance company, you have to stick with the pricing structure that they have. And if you don't, if you decided there's a self-pay patient walking in off the street and you want to give them a discount out of the good of your heart, and if you did that, you get booted out of the insurance company. And we can't really do that. So that's why uninsured patients get such expensive prices, is because that facility is in the insurance networks. So you step outside of that, you remove yourself from the equation, and all of a sudden we can set our own structures. And it's so much more affordable that way.
It sounds like it. So, so I've heard people saying that, like, even if they were with DPC, which is direct primary care, abbreviated for those of you who don't know, even if they were doing DPC, that they still need some sort of insurance. Why is that? Why, if they're doing DPC, why would they still need some form of insurance or coverage?
Yeah, and that's basically has to do with uh, the provider that you contract with. So, like me, I'm a family medicine provider, and I have a scope of practice. There are only so many things that I can do, and if you have needs that are above and beyond what I can offer, that's what insurance is for. So, if you, for example, were to have a major car accident or a major surgery or something like that, that's outside of my scope as a regular old family medicine provider, and that's not really something I can do. So health insurance is there to protect you for those kind of catastrophic costs and uh, basically just protect your assets. And the rest of it, the everyday bumps and bruises, the x-rays, the lab studies, all of those things, I can get those far cheaper than you could in a traditional setting.
What do you mean you can get them far cheaper?
Yeah, so like I told you before, when you're inside the insurance networks and you have to follow the insurance billing systems,
Mhm.
if you step outside that and you contract directly with the labs, so I, for example, have contracts with LabCorp, and instead of billing your insurance and applying it towards your deductible, if you just pay me directly and then I pay LabCorp directly, we can get them with about a 95% discount. And you can get
Wow.
$400 worth of labs for $14 and call it a day. So same thing happens with imaging studies. we can get imaging studies for a fraction of the cost because you're not using your insurance. And the same thing, with visits. So I have, I offer all of my visits with a membership, and I don't charge for a visit. There's no charge at all, zero. You can be seen 10 times in a month, and it's the same charge as just the one monthly fee. It's like Netflix for your health.
Wow.
So,
Wow. That's incredible. I like how you phrased it, Netflix for your health. Everybody understands Netflix, and it's like a subscription based, and you can watch all of the shows that you want. So I have a quick question.
Sure.
You said imaging studies. I was wondering like exactly what imaging studies are, because you're gonna have to break it down for me.
X-rays, MRI, CT scans, DEXA scans, pretty much anything you'd go to a radiology place for. You have an option. You can apply it towards your deductible. You can use your insurance, and an MRI is a great example of this. You can use your deductible, apply it towards your insurance, and you would get charged about $3,000 for that. And if you have a high deductible plan, you're going to pay that out of pocket until you reach your deductible. Mm-hmm. On the contrary, if you were to use self-pay, direct pay pricing, bypass the insurance, that's a $450 test. And
wait.
Yeah, you heard that correctly. Yeah.
So you're saying if I need an MRI, I need an MRI for something.
Yeah.
And you are my physician. We are on your DPC program.
Yeah.
My husband and I, let's just say my husband, because he's more likely to get hurt than I am. He's a general contractor. So he gets injured on the job. He needs an MRI. We go to you, or you come to us, because I know you do mobile visits. We probably have to go somewhere for an MRI machine. I'm sure you don't have that in your mobile vehicle yet, do you?
We like to use Health Images, which is coming soon in Fort Collins. They have a location in Longmont and different places, but it's coming to Fort Collins in the next 2 months. So
what?
That's
crazy.
And this is their pricing that they have. You can use your insurance, pay $2,000 or $3,000, whatever your insurance charges, or you can pay them, not even me in this case, you pay them directly, and it's a $450 charge.
$450. That's like
and the same thing happens with X-rays. X-rays, if I use your insurance, is about $450, but if you pay them directly, $60.
Wow.
That's it.
That's crazy.
Mm-hmm.
So what you're effectively doing is cutting out
the middleman.
Yeah, and we're going straight to the source.
Mm-hmm. Yeah, you can do that with blood work. I can do that with lab studies. So I've done the numbers before. And so the problem is the entire medical system is built on a concept called fee for service. Have you ever heard that term before?
Fee for service? Can you explain that to me?
I can, actually. So fee for service, the entire medical system is built upon it. It goes back generations to the very inception of modern medicine. And it's exactly what it sounds like. If you go to get a service, if you go to the doctor's office, you pay for the services that are provided. The problem is built into those services. When we are paid for a service, it also includes the overhead. It includes the doctor's salary, it includes the nurse's salaries, the power bill, the water bill. All of those things are included in each and every service. So when you order a blood panel with 5-6 different lab studies, and each and every one of them has that built-in markup, that's how patients can go from 0 to thousands in nothing. So I ran the numbers, and on average, across the board, no matter what we do, there is about a 3,000% markup above the cost of materials and supplies to treat a person that these services actually cost. So if you have a 3,000% markup on every single service, and you go to the doctor and you get an X-ray, you get some blood work, and then you have a follow-up visit, and you've just spent $1,000, where did my money go? It doesn't cost that much, but that's how much you get charged. So yeah. So it's called fee for service. The difference here, direct primary care is retainer medicine. So it's the subscription model, and the subscription is where all of my overhead is taken out. So you pull out the overhead expenses and the markups from each and every service, and you fix it to a monthly fee. And that's how patients can get that stabilization of expenses throughout the year.
Gotcha. So instead of paying for like a whole hospital worth of things that need to be taken care of, you're able to cut that out and have the smaller expenses subscription based, and then utilize these other services at your cost with, you said it's a very, very small markup, like
So
very small.
all of my services that I are marked up 5%, and
Five,
that's to
5%,
that's it.
5% instead of 3,000.
Yep. So 5% to include the 2.5% of credit card transaction fees plus 30%. So I will do 5% across the board, rounded to the nearest dollar, and I'm done. And that's it. So if you look at my services, the absolute most expensive service that I do is a biopsy for $35.
Wow.
That's it. And that doesn't include any visit charges or anything like that. It's just $35 and we're done.
That's
So,
that's wonderful. Why? I mean, I can hear your passion, and I can see more and more as we talk, like why you decided to do direct primary care. But what actually stemmed your desire to become a PA and then to get into direct primary care aspects of it all? I'd really love to hear this.
That's how much time you got?
Enough. I have all the time that you want.
Okay.
Tell me the story.
So when I was in college, I originally went to college for aerospace engineering. Yeah, I'm from Orlando, so I live right next to the Space Coast, and I had an entire life plan of working at NASA and Lockheed Martin, and I had it all planned out, honestly. And in my first 2 semesters of college, I got really sick. I went to about 17 different doctors over the course of a year. And I just back to back to back, I probably spent no more than 5 or 10 minutes with any of them. And these are all different specialists. These are all MDs and everything. And 10 minutes, that was the max I got to spend with any of them. And finally, one day, I met a PA, and she kind of saw my history. She saw all these visits, and she went into her, like, I actually heard her do this. She went to one of the nurses and said, just tell all my other patients I'm going to be late. And she came in, she sat down, she turned off the clock, and she's just like, just tell me the story. And she sat down for almost an hour, just listening. And by the end of it, she was like, I want to get an MRI on you. And she sent me off to an MRI, and lo and behold, there was a problem. And I got sent to one more specialist. I had like 3 surgeries after this point. But it was that one thing. It was that time with the patient to sit down, to talk with them, to understand where they're coming from, to listen. And when I got, into when I decided, do I want to go to medical school or do I want to go to PA school? I kind of just remembered that PA that just had the time to talk with me, and how much that affected me versus, all of these specialists that went to school for 30 years. But it was the person who actually talked to me that made the difference. And so I went to PA school instead. And when I got into practice, I got thrown into the system, and I was seeing patients every 10 to 15 minutes. They were double booking me. I was seeing 30 patients a day. And there kind of came a point where I was seeing them so fast, I was burning out. And I'll never forget this moment. I came out of a patient room and I talked to my medical assistant, and she's like, hey, such and such patient just called. And I'm like, who? And figured I hadn't seen them in a month or so, but turns out I'd seen them an hour prior. And the truth is that when you are personally responsible for over 2,000 patients and you're seeing 30 patients a day and you're just churning and burning so fast, you don't get to know anybody. And you can't even remember their names when you're walking out the door. And that age-old question, does my doctor even know me? No, they don't. And that's what I wanted. I wanted to get to know my patients. I want to spend time with them. I want to remember them. I want to know everything about them without having to look at the chart. And the fact is, you cannot do that in the traditional system. You just can't. And direct primary care is a way that we can. So
That's amazing. Like I have so much respect for you for not only deciding to do direct primary care, also deciding to do your own practice and to have it on your own terms from your personal experience in the system and getting the healthcare that you needed and just uh, what's the word that I'm looking duplicating what that other PA had done with you so you could have that personal touch and the care with the people that you're you know that are
yeah,
within your DPC program.
I look back on that PA that saw me, and having worked in the system, I know for a fact that she probably made 3 or 4 patients wait behind me in order to see me for that long. And then there was 4 patients every hour behind them. So she probably didn't get out for 2 hours later that day. And every single patient behind me was probably very angry with her. and and that's the reality. Like, in the traditional system, you have a choice. You can spend time with your patients or you can stay on schedule. You cannot have both. And in DPC, you can. So
how did you hear about DPC? Like, how were you introduced to this whole
that's
platform?
a story on its own. I originally tried to start a concierge medical practice. So I had never heard of direct primary care. So I was going to start a concierge, which is similar, that it has a membership fee and you're still in the insurance networks though. So you still have the fee for service. You still charge for visits. You still charge for all the insurance stuff. You're still in network. And I was looking for a medical director to join me and to come with me to the practice and to supervise me. And the one I talked to was familiar with the direct primary care concept. And she's like, you know what? After listening to you and what you want to do, you're not going to get what you want in the system. You should look at direct primary care. And I Googled it and I was like, sold. Hook, line, and sinker, same day, changed my whole model. My whole business plan changed overnight as soon as I learned about the concept. That I didn't even know it was possible to do what direct primary care does, because nobody teaches you this stuff. Once I found out it was possible, next day everything changed. So
That's powerful. I mean, I understand. I've built multiple businesses, so I understand what it takes to build a business, put everything into play, start doing the marketing, advertising, getting the team in place, the systems and the processes, and then to see something else and be like, oh my gosh, I want to do this.
This is so much better.
Not just change direction, but trash everything that we've been working on and then make it bigger and build it better.
Yeah.
Wow. That says a lot for direct primary care and the type of business that you're building. Wonderful.
Thanks. So yeah, it's so far so good. Just launched a few months ago, and yeah.
So what has it been like launching a business during COVID, and what are some of the types of services that you've been implementing and offering, and some of the differences now that COVID's around?
Well, I mean, COVID threw a loop for everything. Obviously, we all know that. The biggest thing that it changed was my marketing plan. And initially, I'm new to Colorado. I had just moved here to literally to start the practice. And my plan was to be going out, doing seminars, and meeting people in person to educate them. And I was going to go to like the farmers markets, and I was going to set up a table, and I was going to do all this stuff to educate, because the fact is that DPC is a unheard of model. For many patients it just requires a conversation. And the whole marketing plan was initially to allow myself to converse with people. And all of a sudden everything shut down. So that was fun. And so I've, detoured and joined some business groups that were online, and, joined the Chamber of Commerce, and working on my digital marketing now. And so there's kind of a lot of detours that I've been working on. As far as COVID services, my initial plan was to have an office. I was going to have an office, and I was going to be inside my medical director's practice. And by the time I launched, so he was on the process of doing a renovation of his office space when COVID hit, and it was supposed to open up like a month later, and then the contractors all stopped working during this renovation, and he still hasn't opened up the office. It's been 7 months and it still hasn't finished renovating. So that whole fact, I went from an office to thinking to myself, do I really need an office? And no, you don't. It's yet another thing that has been ingrained in the system. You need a brick and mortar. You need this. You need this. You don't. And I don't have to charge my patients for that overhead either. So yeah, I figured out how to do it all on my own. I'm able to offer full scope primary care. I do sometimes need an office, and I am working on setting that up for drop-in appointments as needed, but don't need a brick and mortar, at least not yet. So.
Wow, you've pivoted and grabbed a hold of this opportunity and the local Fort Collins area to just be the absolute best that you can be for not only yourself, but your patients that you're going to be taking care of. So here's a question about like, who's DPC for? Like what are some qualifying things, or how about this? Factors, that's what I'm trying to say. What are some qualifying factors that people want to take into consideration to see if direct primary care is viable for them or not?
Sure. So there are two major populations that direct primary care is not only amazing for, but recommended for. The first one is a patient who has no insurance, who is uninsured. Doesn't matter if they're healthy or unhealthy. If they're uninsured, it is a great model for them to offer a layer of protection. It's not insurance. I don't pretend to be insurance, but it is a layer of protection to make sure that you stay healthy. The second one is patients with high deductible insurance plans. So by high deductible, I mean the catastrophic plans that have $8,000 deductibles on them. Those are kind of the target markets here, because the fact is that I don't charge $8,000 for my services. You don't get charged hundreds of dollars. It's a simple membership. On average, for an adult patient, it's $85 a month, and you get all of your visits, and you get all the near cost services provided at that cost. And over the course of a year, that's $1,020 for the entire year. And that is far below your deductible, and you could get 50 visits plus all of your services provided at near cost for that price without ever reaching your maximum deductible. So it works great for people who are self-employed. It works great for families. It works great for uninsured. It works great for pretty much anybody who wants to improve their care without spending a fortune on it.
A lot of people are spending small fortunes.
They are. You could literally go to your doctor, order one MRI, and spend double an entire year's worth of a direct primary care membership. So you could get for the price of one MRI and the office visit to get the order and the office visit to get the results. So it's 2 visits plus the MRI, somewhere on the order of $2,500 to $3,000 is the equivalent to an entire year of direct primary care membership, plus an MRI, plus blood work, plus x-rays, plus 12 visits, a visit a month. It's like, how much care do you get for that cost? What's it worth to you? So
it's worth it. I know from my personal experience, my husband and I have been doing DPC for 2 years now, and it's nice to have a doctor at my fingertips. It's nice for me to be able to have the contact that I need. I was sick with influenza, not COVID. This was before COVID hit.
That too, not fun.
I was sick, and we reached out to our physician, and I just said, I'm on the couch, I can't move. And he was able to help us out right then and there. It wasn't like I needed to go in. He didn't need to come over. We did like a telehealth visit, and he's like, all right, I'll help you out. My husband went and picked up my prescription. And it was great. I was able to get liquids in. He's like, we could do an IV for you too if you need an IV. And I was like, I think I'll be okay if I can just start drinking again and stop this vomiting and dizziness and everything. But it was bad. I was absolutely floored, and I wouldn't have been able to go in. And he was willing to swing by and give me an IV,
Wow.
which is like above and beyond in my opinion. And that's just, I didn't have to schedule a crazy appointment. It was just so much easier and beneficial. Like I personally love direct primary care. If I ever need or want anything, having this subscription-based monthly fee, we actually pay annually. And
Nice.
that's it. Like, it's taken care of. Plus, as you were saying, the small amount per thing that needs to happen. But it has saved us thousands. Like, it has saved us thousands of dollars. We don't even need to go to the doctor a lot of times. A lot of years we hadn't before. We hadn't been covered prior.
I'm actually really glad you brought that up. Are you familiar with healthcare avoidance? Have you heard that term?
No. Am I a prime suspect for that?
Well, based on what you just said, kind of. So one of the things I've found in the first class, my opening class of patients who joined, like 3 or 4 of them all told me that they haven't seen a provider in 4 or 5 years. Every single one of them said that, and basically told me that they don't know if this is going to be worth it to them. And within the first 2 months of care, they have received over $1,700 worth of care, but for less than $200. Like, the truth to me that I learned from that is that telling someone that you haven't been to a doctor or provider in 5 years does not mean you're healthy. It means that the expense and inconvenience of going to the doctor it wasn't worth. You were not bad enough to warrant the cost and inconvenience associated with going. So
bingo. I am a prime candidate for that. I was anyway.
Yeah. So when you sit there and you're like, oh, my visit is paid for already, and it's not going to cost me it's not going to cost me a penny to be seen. Yeah, you're going to pick up the phone and you're going to do your well screens. You're going to get some blood work. You're going to get actual preventative medicine, because it's not going to cost a fortune. It's going to cost $10. So, there is a difference.
There is. I'm so glad we brought this up. I mean, I hadn't been to see a doctor in a decade prior than that, a full decade. And I would just pay. I know this is horrible. I would just pay because it was cheaper to pay they used to have it to where you get penalized if you didn't have health care, to pay that health care fine or whatever it was actually cost less than for me to have health care. Me and my husband have health care all year long. So I just waited till tax time. My CPA was like, do you have insurance? I was like, nope. And we paid a little fine and it was over with. But now at DPC, we do get seen and taken care of. And you're so spot on, Jason. there are things that were wrong or problems that I had, and it wasn't worth my time and energy and effort to
Yeah.
schedule the appointment, to wait for a week, to have to go in like
Yeah.
at a super inconvenient time when I was experiencing the issues right then and there. And
So you have patients who they got to take off work or something,
mhm.
and not even an hour ago, actually an hour and a half ago from here, I actually went to a patient's work, and they stepped outside. I gave him a quick little injection and I left. Like, he didn't have to go anywhere. He didn't have to take off work. I went to him, and like, he didn't even have to take more than a lunch break.
I think the
So,
mobile visits that you're providing for your
mhm.
clients are wonderful. It's just absolutely wonderful. And it's something that people have looking as more like a luxury item, but you're making it to where it's affordable, and not even affordable, but cost effective,
Yeah.
especially with everything that they're getting. I mean, they're getting you, and you
The
have incredible training. You're really like easy to talk to. You're knowledgeable. You care about your patients. You care about people who aren't even your patients. Like, I mean, you're just
pretty
an all
much, yeah.
around good human. So it's wonderful what you're doing for the Fort Collins community and the people who are in there. I know you talked about people who are self-employed. Are like this being good for people who are self-employed. Do you have any like other types of um, like what type of self-employed people? There are people who are self-employed doing like direct sales. There are people who
So
are realtors. There are people who
honestly, it'll work great for any 1099 contractors, people who are responsible for their own health insurance kind of thing. And even if they do get insurance, like, this can be offered as a benefit. Like, if there was an employer who wanted to provide my services to their employees, that's possible too. It's just, there's so many options. It's just a conversation that we can have. So I deliberately, I don't have a million policies in place saying I can do this, I can't do that. It's just a conversation, and we can help each other. We can help each other. So
so who would not be a good fit?
uh, that is very simple. Medicare, Medicaid, TRICARE, the entire federal insurance programs.
Mm-hmm.
And the reason for that is because there are federal rules and laws that prevent me from privately contracting with one of those patients.
Mm-hmm.
So if you have any of those, I can't accept you. And even if I did accept you and you later got it, it would force me to terminate a membership. So yeah, Medicare, Medicaid, TRICARE, they are not friendly towards privately contracting, to the point of I would actually get arrested for it. So yeah, no bueno. um,
Gotcha.
but yeah, anything else, totally fine. And uh, we could just have a conversation and see if we'd be a good match. So
That sounds easy enough. Do you have any? So I always like to ask people if they have any educational books or any mindset books or books that they've read recently that just stand out to them. Or do you have any favorite books that you'd suggest to people who are listening right now?
hmm, that's a great question. I just read a book a few days ago. It's a very long book. It's about 30 pages. It's called The Core 4 Method.
Uh-huh.
Have you heard of this?
No, I haven't.
So basically, instead of doing to-do lists, it's a what I've done list.
Mm.
And it, it was an interesting concept because the first thing I tell anybody looking to do weight loss or to, manage their blood pressure is to track what they've done, not to make some big lifestyle change. And I never thought of that as a to-do thing. And they do the same thing. They, instead of doing a to-do list of everything you need to accomplish, track what you've done and see what you're missing.
Mm.
And it's an interesting concept, and it was like a $5 book, and it literally is probably 40 pages, double spaced. Probably didn't need to be a book. It was probably a blog, but it was an interesting thing. And I just read it the other day, so that's why it's the first thing on my list. And it was on my desk.
Awesome. I'll definitely read it. I love I can't get enough education. Like every day I educate myself in some manner, some way. Learn, do, teach. Got to do it.
See one, do one, teach one. It's the medical model.
Yeah, I just wrote it down. So the core 4 method, was there an author for that?
Lori Maccomer. I'll send you a little chat really fast.
Awesome.
I can spell.
Got it.
Yeah.
Thank you very much. So I just want to thank you again for taking some time to chat with me today and to explain direct primary care and what it really is and what it isn't.
It's a relationship, not insurance, but it is a relationship with someone, and they can save you money. So,
and ensure that you have proper health care.
To ensure that there's somebody who has your back, and doesn't matter if you change your insurances, doesn't matter if you lose your job, doesn't matter if you, as you go through life, there's one person that watches and monitors and keeps you healthy. And that's what we do.
So for those who are listening, could you refer them to your site and maybe another place and tell them who you are again real quick?
Yeah, so I'm Jason Rogers. I'm with Starlight Health, and you can visit the website at www.starlighthealth.com. I am a big fan of the entire direct primary care model, and I am not the only one. So if you feel like there's another one that maybe fits your needs a little bit better, there's a few more in the area. And you can go to, if you go to Google search and look up DPC Mapper, it'll bring up all of the other ones in the area. There's about 4 or 5 last time I checked. That's Arctos, there's Nilco Direct Care, there's a few other ones. And the wonderful thing about direct primary care is that no two are alike. It's, like I said, it's a relationship. You don't click with every person that you meet. Sometimes you have better friends than others, and it's the same thing here. It's not a cookie cutter approach. Every one of us is different. Try the one that works best for you. So
you're a phenomenal human. And once again, you can go to Starlight Health. He also has Instagram, LinkedIn. You have a Twitter feed too, right?
I have a Twitter feed.
And
I need some
Facebook.
followers though. I need followers.
Well, for those of you who are listening, go ahead and follow Jason with Starlight Health. And I hope you have a wonderful day, Jason. I greatly appreciate your time and you adding value to the lives of others around you.
Thanks for having me, and I appreciate your time as well.